Hello, I'm Yan Yu. I will summarize some key parts in the clinical trials in general here. First of all, the objective. The objectives of a clinical trial is to assess and compare the safety and effectiveness of health interventions such as drugs, devices, or therapy protocols. For example, if we have a newly created drug and we want to compare it with the commonly used one in the market, then we can use a clinical trial to achieve this goal. So due to the uncertainty of the safety and the effectiveness of the newly created drug, the clinical trials involving new drugs can be classified into 4 phases usually. Different phases have different purposes and can answer different questions. For example, phase 0 is the first in-human trial, and usually 10 to 15 subjects are involved. Phase 0 is often used to get the information about what drugs do to the human body and what the human body does to the drugs. The number of subjects can be involved will increase when the drug passes the phase 0 to the phases at a higher level. That's the phases. So later, thirdly, I'd like to explain another key part in the clinical trials, that is the endpoints. In fact, endpoints is what we want to measure in a trial. Based on the endpoints, we can use the statistical test to do the hypothesis test and get our conclusion. Usually, a typical trial will define primary endpoint such as overall survival, and maybe will also define many secondary endpoints such as progression-free survival or response rate. Here, I'd like to explain one commonly used endpoint, that is the overall survival, OS, which is defined as a period of time from the beginning of the trial to the death event, no matter what's the cause of death. So that's the endpoints. So after getting knowledge about what we have to measure in the trial, we also have to know the sample size before the trial is conducted. Sample size is very important because we can imagine that if the sample size is underestimated, then even a very effective drug, the result of the trial can turn to be very negative. According to other economic and other reasons, we can imagine that it's also unlikely to have very large sample size. It's unrealistic. So calculating the most suitable sample size is very important before the trial is conducted. So then I will explain the trial design. A typical trial is often designed as randomized, blind or double-blind, and placebo-controlled. The meaning of each item is, for example, the placebo-controlled means that we will also use the placebo, the fake treatment, so that the researchers can isolate the real effectiveness of the treatment from the placebo effect. And the randomization means that the subject is randomly assigned into the groups of treatment, the study treatment or the placebo treatment. And the blind means that each subject doesn't know he or she is receiving the study treatment or the placebo treatment. And the double blind means that, on the other hand, the researchers also don't know given subject is receiving study treatment or the placebo treatment. As the last, I hope to explain another important part of the clinical trial, that is the interim analysis. It is used to find convincing evidence to say there exists a significant difference between treatment groups, and the difference is convincing enough so that we can stop the trial at a point earlier than it is expected at first. So why the interim analysis is necessary? I think the ethical reason is the primary reason. because we all hope to make sure the maximum number of patients, the subjects, are receiving the best treatment at the earliest stage. And the economic reason is also often taken into consideration because sometimes clinical trials are expensive, so interim analysis enables us to reduce the number of patients and reduce the follow-up time which we need before the conclusion can be made. Of course, there are many other issues such as administration, ethical conduct involved in a clinical trial. So then I'd like to talk about the clinical trial design. Before I explain it, I have to make several conceptions. First of all, we suppose that we have a newly created drug, I call it drug A, which can cure a typical kind of cancer. And corresponding to drug A, there is another commonly used drug, I call it drug B, in the market to cure this kind of cancer. So under this assumption, the purpose of my trial is to assess the safety and effectiveness of the drug A to cure this cancer on the patients who failed the treatment by the drug B. So my trial will be is a phase 3 and will be designed as a randomized placebo-controlled double-blind trial. Besides the placebo-controlled and double-blind, just as what I explained before, I hope to explain a little more about the randomization. Here, I hope that each subject will here I will have two groups. One group of subjects will receive drug A, and another group will receive the placebo. And I hope the subjects will randomly assigned into these two groups based on the stratification factors I designed. I think the stratification factors is that I think which is maybe potentially or obviously will affect the treatment effect. So I just hope to keep all the factors at the same level in the two groups, except they will receive different treatment. And the endpoints. The primary endpoint I will choose is the overall survival, and I will also design several secondary endpoints such as progression-free survival or the response rate, and I will use a statistical test to do hypothesis test based on both the primary and secondary endpoints. And the sample size. Before the trial is conducted, I will calculate the sample size based on the endpoints and the test I chose. And statistical tests. Besides the test I will use in the hypothesis test, if necessary, I will also do some sensitive tests to verify the robustness of this trial. And I will also design an interim analysis at the middle of the trial to see if the trial can be stopped at the earlier stage. So if there's enough significant evidence to say that we can stop the trial earlier, then if the drug A is turned out to be effective and safe, then I will let the subjects in the placebo group receiving the drug A and use the same tests to do the hypothesis test and get conclusion at the last, and to see the conclusion, whether the conclusion is same as the one in the interim analysis. And after all this process, I think we can get the conclusion about whether the drug A is effective or not at the end. That's all. That's the clinical trial I designed. Thanks.